Okay, this is a presentation of COVID data collected over the past 5 or 6 months for all 50 states, and today I'm going to present in this presentation the Mid-Atlantic states, which include Delaware, Maryland, New Jersey, New York, Pennsylvania, and Washington, D.C. Or not Washington, D.C., but District of Columbia. Sorry, District of Columbia. So let's start with Delaware. Delaware, a state of about 1 million people, they have not had a record case or death date in quite some time. It's been 3 or 4 months, so that's good. Number of cases has increased over the last 30 days more than it was the previous 30 or 60 days. Prior to that, the number of deaths went down and then went up a little bit, so I'm not sure I'm concerned with that or not. It is such a small state. Number of tests, and they're testing less than 2,000 people a day, but it is a small state, so that can be forgiven. Positive test rate, though, has gone up slightly. They're around a little over 5% for 2 months, and the last month they've gone up to about almost 6.5%. Their death rate is down fairly low, so that's a good thing. If we look at their 14-day trailing average positive test rate, though, they've kind of bounced around. They were under 5% mid-July to about the 10th of August. Then they jumped up for about 2 weeks, and they went down for about 2-3 weeks, and then they started climbing back around, actually before Labor Day, so you can't really say Labor Day was the cause of it. A day or two before Labor Day they started to rise, and they peaked out at close to 8%, and currently they're sitting at about 5.5%, a little over 5.5%, but there's a little hook uptick here, so not sure what that means. If we look at their daily cases over the last 90 days, they were straddling and under the R1 line for a while, and it's kind of disturbing. The last couple weeks have kind of gone up more above the line than below the line, so that bears watching for Delaware. Daily tests have been pretty consistent, but not quite as high as you'd like them to be. I'd like them to be around 2,700 tests a day. It looks like they're around 2,000 or a little under. They need to improve that. Maryland is the next state we're going to look at. Maryland, population of about 6 million people. They have not had a record death or case date in quite some time. Our number of positive cases have gone down steadily. The number of deaths have gone down as well. Their testing the last 30 days is the highest of the last 90 days in a 30-day period. Our positive test rate is fairly low, and their death rate's low. So let's see what their 14-day trailing average positive test rate looks like. And as we can see, they were around 3.5–4% up until early August. They dropped down, leveled off towards the end of August at 2.5%, ticked up a little bit, and then went down, and they've been between 2 and 2.5% for the past 10 days or so. So that's a good sign. So Maryland, even though we have to be careful because of what we've seen in the last week or so, 10 days, as far as cases, they're still in a good place. They just need to be careful. Next state we're going to look at is New Jersey. New Jersey, almost 9 million people. They have not had record case or death dates in some time. The disturbing thing, though, is the number of cases have shot up. 11,000, 8,000, now up to 21,000. Their deaths have gone down. Their testing has gone up. So maybe this has something to do with cases, but maybe they're just testing more because people are coming in to get tested because they're afraid they have it. Their positive test rate was very low, and it's gone up almost double where it's been, but it's still very low. So I imagine when we look at the graphs, we're going to see some trends, maybe some disturbing trends, but their death rate has consistently gone down. We look at their 14-day trailing average positive test rate. They've been pretty much between 2.5% and 1% from the end of June until Labor Day. It dropped down under 1% after Labor Day, but there's been a disturbing trend over the last, say, 3 to 4 weeks where it's gone up. It's not any higher than it's been, but anytime you see this trend, you have to worry about where it's going to go. It has kind of flattened out over the last 10 days, so maybe that's a good thing. Maybe it won't keep going up, but that bears watching. If we look at the number of cases over the last 90 days, they were consistently below their R1. This is what you want to see for the virus to get squelched. To see it down here, there were a few days back in September where they didn't report at all. And that was a holiday weekend, I think. But recent trends are disturbing. Nonetheless, they've gone above the R1 line for the first time back on October 8th. They've dipped below, then they're above, so this bears watching. I'm seeing this trend in a lot of states lately. The last week or so, they've gone up. So New Jersey has to be careful as well. If we look at New York hasn't had any record case or death dates recently, similar to New Jersey. They're right next door. As far as cases go, cases have gone up this last 30 days, which is very disturbing. Number of deaths went down and they went up, but they're still not as high as they were 61 to 90 days ago. As far as testing goes, they're still testing. They're increasing their testing, which is amazing. They're now testing about 100,000 people a day, I'd say, which is very good. Their positive test rate's has been low over through the summer months. We know how it was extremely high back when they were first hit in spring. They really got it under control. Their death rate is down as well. So if you look at everything cumulatively, they look pretty good except for this right here. New cases, recent trends. And let's take a look at the 14-day positive test rate. Positive test rate is pretty much between a little under 1 and 1.5% through the whole span from the end of June up till now. I think this daily cases will be more of a harbinger of what's going on. See, although they were below the R1 line, they were about half or less than half of the number of cases. And then recently, since late September, there's been an upward trend, another disturbing trend, just like a lot of states I'm seeing lately. So they need to be really careful with that. Next state we're going to look at is Pennsylvania. Pennsylvania, almost 13 million people. They have not had any record case or death dates in a number of months as well. But you see the same thing here, similar to New York. The number of cases have jumped in the last 30 days. Deaths have jumped as well, but they are testing quite a bit. I mean, they are testing about 18,000 people a day. Is that right? Yeah, it's about 18,000 people a day. Their positive test rate has gone up slightly. They're not under 5%. And their death rate has gone down slightly over time. Let's look at their positive test rate, 14-day moving average. They got under 5% sometime in mid to late August, but then they went back above, and I think this right here, this severe drop, has something to do with number of tests maybe reported on October 7th, but they straddled that 5% line and now they're back above it. Let's look at what happened on the 7th or 8th. Yeah, they tested, I don't know if this is a misreport or not. I mean, I've looked into it, and other sites where I grab data from, and other sites where you can grab data from, they all report the same thing. So maybe they did test that many people, 130-something thousand people on that day, whereas they typically test around 20 or under 20,000. But nonetheless, based on the projections here, the trend I see here, not so much here, the trend I see here, and this number here, I'm a little concerned about Pennsylvania. Oh, let me get back into it. So that was Pennsylvania. Washington, D.C. is the last state in the Mid-Atlantic states. And let's see, they're under 1 million people. They have not had a record case or death date in quite some time. The number of cases are pretty flat. They've gone up a little bit, but not measurably. Number of deaths are low. Their tests have gone up. Their positive test rate has gone down. Their death rate, however, has gone up. So let's see what their trailing average positive test rate is. They've been consistently between 1 and 2.25%, and they're pretty flat. So this looks good. Let's see how their cases go. Okay, they got below the R1 line, and they stayed down there through all of August and September. And then you see this little trend here. I don't know if it's a trend or not, but it seems like it's a little bit higher. So DC has to watch out, keep their guard up. But overall, Washington, DC looks pretty good. That concludes our presentation for the Mid-Atlantic states for COVID data ending October 17th, 2020. Thank you.